Yeah, the project focuses on how COVID-19 is affecting farmers' mental health, and also focuses on the organisations who provide support to farmers in distress. So civil society organisations like faith groups, mental health charities, NHS services, family, friends. Before we started the project, I think anecdotally, we'd heard that many of the support giving organisations were struggling to provide their support through COVID for various reasons. So one was their fundraising activities were curtailed through shielding and lockdowns. So the National Federation of Young Farmers Club reported a £1 million shortfall in funding last year, and that was heavily affected by COVID. Many of the organisations that provide helplines to farmers were struggling to provide the required number of staff because of lockdowns and shielding. I think for an individual farmer, resilience and well-being means that they are in good physical and mental health, or feel that they can access support quickly, such that their everyday work that they do in their farming business is not adversely affected by health issues. So I think a more resilient farming population is not one that necessarily don't have physical or mental health problems. I think it would be unrealistic to think that those would go away. But a resilient farming population would know that they could reach out at an early stage to accessible support providers, both for mental health and otherwise, and they could access that support before problems got worse. And if interventions can be made before problems get worse, then the physical and mental health of farmers will improve, and by definition, that should help them better withstand some of the shocks that will continue in this country, such as Brexit, weather, climate change. And then I think one of the most important parts of the project is to try and bring policymakers from DEFRA and the devolved administrations together with researchers and farmers and those support-giving stakeholders to try and understand what the key lessons are to learn, to understand where there might be gaps in provision and how this landscape can be best supported so that the best care is provided for farmers beyond just England and Wales to the other devolved administrations and hopefully beyond that.